Hello dear students, this lecture for students for course General Medicine. Topic is Hypertension association with pregnancy. My name is Слободчикова Т.С. I am assistant department of Obstetrics and Gynecology. Today we will discuss hypertension, symptoms, criteria of diagnostics, treatment and prevent care. Hypertension is diastolic blood pressure 90 or more and systolic blood pressure 140 or more, missed 2 times with at least a 4 hours interval. Chronic hypertension, first diagnostic after 20 weeks gestation age and persistent after 6 weeks postpartum period. Gestation hypertension, blood pressure 140 and 90 for the first time in pregnancy after 20 weeks without proteinuria. Blood pressure returns to normal within 6 weeks of postpartum period. Preeclampsia is defined by hypertension and proteinuria. For women who don't have chronic hypertension, an elevated of blood pressure above 140 systolic or 90 diastolic meets the criteria. Proteinuria is defined as more than 300 mg of proteinuria in 44 hours urine collection. Eclampsia, woman with preeclampsia complected with convulsion and or a coma. Classification: chronic hypertension, gestation hypertension, preeclampsia, mild, severe and eclampsia. Degrees of hypertension: mild, moderate and severe. Mild hypertension doesn't mean diastolic blood pressure 90 to 99. Systolic blood pressure 149, 100 to 109. Moderate hypertension, it doesn't mean diastolic blood pressure 100 to 109. Systolic blood pressure 150 to 159. Severe hypertension, diastolic blood pressure 110 and more, systolic blood pressure 160 and more. Risk factors for preeclampsia during pregnancy. Preeclampsia or eclampsia in previous pregnancy. Family history, multiple gestation, it may be twins, chronic disease, renal disease, chronic hypertension. Obesity, it doesn't mean body mass index 35 and more before pregnancy. Maternal age 20 years and 40 years and more. Antiphospholipid syndrome. Complication: during pregnancy, women come to doctors and sometimes have this complication: headache, epigastric pain, edema, flies flash before iris. Management depends gestation age and decrease of hypertension. Chronic hypertension, pregnancy woman before 30 weeks receive treatment in therapy. After 30 weeks receive treatment in maternity hospital. Gestation hypertension, mild and severe, all time receive treatment only in maternity hospital. Management of hypertension, drugs of first choice is methyl-dopa. Methyl-dopa we must used only orally. You may prolong the pregnancy with chronic hypertension and gestation hypertension to 37 weeks. Doses, methyl-dopa doses used 250 milligrams may be increased 2000 milligrams daily. It depends about degrees of blood pressure. You may choose doses and correct every 3 days. Labetalol you may use during pregnancy too. Used only orally, 100 milligrams may be increased up to 2040 milligrams daily. Sometimes chronic and gestation hypertension without treatment and prevent care complication by preeclampsia or eclampsia. Severe preeclampsia we have symptoms systolic blood pressure 160 or diastolic blood pressure 110, proteinuria 300 milligrams a day, oliguria, cerebral or visual symptoms, epigastric of right upper quadrant pain, low platelets, elevated serum creatinine, elevated liver function test, fetal growth restriction, pulmonary edema. Management of severe preeclampsia, it depends about gestation age of pregnancy. All term pregnancy with severe preeclampsia were delivered. Preterm pregnancy start 24 weeks to 34 weeks. We must administration a short course of steroids to the mother confers significant benefit to premature newborns. We used these drugs to prepare baby to live without mother. Dexamethasone 6 milligrams every 12 hours for 2 days and delivery by induction after 48 hours. Anticonvulsion treatment is magnesium sulfate. Magnesium sulfate 2 doses, loading doses and mounting doses. Loading doses it's magnesium sulfate 25%, 20 milliliters intravenously. Mounting doses magnesium sulfate is 25%, 80 milliliters plus natrichlor 320 milliliters, 11 and 22 drops per hour intravenously. If you used a lot of magnesium sulfate, it may be hypermagnesium. You have symptoms, colic, decreased respiratory rate, heart rate, oliguria, depressed, deep tender reflex. If pregnant woman have these symptoms, we must use antidote to magnesium sulfate. Antidote is calcium gluconate. Use 10 milliliters, 10% intravenously. Anti-hypertensive agent, we used nifedipine. Nifedipine we used only emergency care. It's calcium channel blockers. We use 10 milligrams orally. Repeat in 30 minutes if needed. Maximum doses of nifedipine is 120 milligrams. Sometimes, if it's preterm labor, we may use nifedipine to prevent convulsion. But if you have severe preeclampsia, we use nifedipine only emergency care drugs for blood pressure. Complication of severe preeclampsia, it may be abruptio placenta, HELP syndrome, renal failure, disseminated intravascular coagulation and pulmonary edema. After labor, we must use recommendation for women. Contraceptive for at least 1 year, close follow-up next pregnancy, and low doses acetylsalicylic acid 75 milligrams 1 daily, and calcium supplementation 1 gram daily can be considered for the next pregnancy. Thank you for your attention.